there, I'm Diane. I've come to look after you today. The nurse has just pushed you into the anaesthetic room and the anaesthetist just out there at the moment. Just going to take a few details, if I may. If you can confirm your name for me and your birthday, please.
My name's Bilbo Atkinson. I'm 92 years old.
Bless you. And the date of birth?
The day of birth is the 1st of February 1940.
So we're just checking the consent, that all matches, and your wristband is fine. So what are you having done today then, please, Bilbo?
Repair my hernia on the right side.
All right then, that's great. And has the surgeon marked it earlier with a pen?
Yeah, he drew a big black arrow on there.
Ah, you're a star. Do you mind if I just have a little peep, just to check?
Fine.
Just go and have a little look. Not going to expose too much, I'll keep it warm. That's great, I can see that's been marked. So after checking all the details there that we want to make sure that... Have you got any allergies as well, Bilbo? We need to know things like that as well before you go to sleep.
No, not that I know of.
Excellent. And I think you've had your teeth removed, is that right?
Yeah, I asked if the nurse would take them out. I don't really need them. They're not fitting that well. I need to get back and get it sorted.
Oh, bless you. I'm going to take your glasses as well to keep them for safekeeping, okay? So I'll pop them on the side.
I only need them for reading.
That's all right. We've done with that then. So all the checks are happy with. We're fine. We've done all that. We'll move on. Just double check if the consent form's in there. He's got all his notes. When did you last eat and drink, please, Bilbo?
About 6 o'clock this morning. I had a bit of toast and a cup of tea.
That's fine. So in the afternoons we've been starved long enough for this procedure. So you're going to be having a general anaesthetic. We've got quite a little bit of kit ready for you. The anaesthetist did pop in earlier. We've got the cannula all situated here. You've got some monitoring on. We've got some fluids up here to keep you hydrated, and the blood pressure's here, and you've got all your ECG. So you're nearly ready to go. So you're going to have a nice little sleep, really, and wake up in recovery.
Yeah, hopefully that'll all go well, and I'll be fine to go home later.
Oh, bless. So we'd normally be thinking about putting some kind of airway in for a general anaesthetic, and it's been assessed as being a simple, straightforward general anaesthetic, so we can use an LMA today. Airway was checked earlier and pre-op by the anaesthetist. So you're doing fine, okay? The kit we've got on hand, so we're going to be using this bad boy. This is an LMA, gel. Further intubation, this is going to be a complicated one. We'll be using things like ET tubes, oxygen in this, and we'd attach that just before we're ready to intubate. Just having a little nosy at the backup stuff that we've got here. We've got other airways that you would come in handy if there were any issues. Nasal airways, Angidel airways. You alright there, Bilbo? The anaesthetist will be along shortly, and then we can get underway and we can get you asleep. So everything's been checked, and that's all part of the WHO check. The anaesthetist has all his kit in standby, and the ODP would normally support him by making sure all the checks have been done on his anaesthetic machine. The patient is fully monitored before he gets to sleep so that we can make sure we've got a set of obs. And we'll normally check your temperature as well. Are you feeling okay?
Yeah, the nurse checked my temperature on the ward before we come down. That was 37.
Oh, lovely. So the correct parameters. I think that's been documented. Excellent. So we'll just check it again. It's all looking fine. Good to go. Okay, so Bilbo's had his anaesthetic. He needs to just get through and put him in an eye gel. So he's attached to the monitoring. We're all good. He's got his fluids. We've done a check again, the timeout section. We've confirmed he's having his right angle not only. I'm the scrub person today, I'm Diane. The anaesthetist is Dr. Gandalf, and we've got a couple of runners and various people around that they're doing their bit, so we would normally introduce my name more. Antibiotics have gone in at that stage, and we've got some VT prophylaxis on board. He's got some calf compressors on as well, just to help him with that, so they're squeezing his leg, he seems. And we're ready to go, I think. So we'll normally make an incision on this side, and he would be having some mesh as well. We've got some laparoscopic kit, should we need, if we want to do a laparoscopic version, which I think the surgeon opted for today. And the mesh was on the standby. We don't normally open the mesh till the time it's ready to be put in. It's all nice and sterile. This is aseptic, untouched technique. Everything's clean, sterile, to minimise infection to the patient. Even though he's had antibiotics, we want to minimise as much as we can. Surgeon would be on the opposite side, scrub nurse, and he may have an assistant as well. So Bilbo has just woken up. He's had his LMA removed. Surgery went well. All right there, Bilbo. How you doing? Might be a little bit sleepy.
Yeah, a bit tired. I'm alright.
Oh, great. Anaesthetist did a fantastic job. He's given him loads of pain relief and anti-sickness medicine. He had some ondansetron, and he's had some fentanyl. And I'm just doing your paperwork. Not too long before we can send you back to the ward and you can be with your family, okay?
Thank you.
Oh, great. Just going to check your dressing. So we normally have a little look-see before he gets discharged. His dressing. Bear in mind we want to keep him warm and check his dignity. It's all good. And you're all nice and warm, aren't you?
Yes, I am. Thank you very much.
Checked his temperature, and it was all part of the news chart. You have to make sure that all his observations are logged, which are all on monitor there. And that's all covered in news too. Observation-wise, when he gets to be a little bit more awake, we can do this AFPO score and all the rest of that before we send him back to the ward. As a patient's waking up, the news chart normally looks quite drastic, the scores are quite high, and as he's coming more and more awake, they come down to these at a nice level. Are you alright there, Bilbo?
Yes, I'm fine, thank you.
Excellent. So I think soon we'll be able to hand him over to the ward. Normally use S-bar, which is like a communication tool, and it's just to emphasise what we've done, what medicines he's had in a concise manner without having to rabbit along too much. I think we'll get you back to your family. What do you think?
That would be good, thank you very much.
Lovely. Alrighty. So I'll get the nurse to come up. So we'd normally get the nurse to come to the ward, from the ward, and we can send Bilbo back to his family.